close to the midline. The superior rectus subnucleus is distinct in supplying the contralateral eye, while there is a single midline subnucleus supplying both levator muscles. Dorsal midbrain infarction may therefore cause an ipsilateral third nerve palsy with, in addition, a contralateral upgaze palsy and partial ptosis. The infarct may be visible on MRI. Pretectal nuclei lie dorsally and receive innervation from the optic tract as part of the pupil light reflex. These then pass fibres bilaterally to the Edinger-Westphal nucleus, which is the parasympathetic nucleus responsible for pupil constriction and closely related to the oculomotor nucleus. Fibres from both pass ventrally through the red nucleus and cerebral peduncles and exit as the fascicular subarachnoid oculomotor nerve. Lesions affecting the red nucleus or cerebral peduncles cause ipsilateral flapping tremor or contralateral hemiplegia respectively. Both are easily detected by asking the patient to stretch out their arms.
In this case, the affected eye is the right one. In normal illumination, the affected pupil is 2/3 dilated and presents a ptosis and the eye is looking down and out. In the dark, the affected pupil is still 2/3 dilated. The ptosis and eye deviation are also present and unchanged. The normal eye is dilated, as it should be in the dark. The third nerve palsy and the light reflex test. When light is shone into the affected pupil, there is no direct response, but the left concentric constriction is still present. When light has moved away, the left pupil dilates a little, but the right pupil does not. Here is the left constriction and dilation. When the light is shone into the normal pupil, there is a left direct response, but there is no concentric reflex on the affected side. When the light is removed from the pupil, it dilates. The affected side remains the same. There is no response at all. Note that depending on the severity of the palsy, the affected pupil might constrict slightly to direct and concentric light. The swinging light test. When the light first shone into the affected pupil, there is no direct response, but the left concentric reflex is present and rapid. The light is then moved into the left normal pupil, which reacts instantly. The right pupil does not. There is the left constriction, slight redilation, and constriction again. The third nerve palsy and the CNIII test. In a resting state, the left pupil is neither large or small, but the right pupil is still dilated 2/3. During the CNIII fixation, only the left eye converges and constricts due to accommodation. The right pupil remains still. Changing from a near to a distance fixation produces a left dilation, and here the left pupil constriction and convergence.